What is the aim of the cancer prevention team at the Ulster Cancer Foundation?
The aim of the cancer prevention team here at the Ulster Cancer Foundation is to reduce the impact of cancer in our community, eventually hoping to reduce the number of new cases that we have and the number of deaths every year. Currently we have about 10,500 new cases of cancer, new people diagnosed with the cancer here every year, and those figures unfortunately are rising. The main reason they're rising is that cancer tends to be a disease of older people. So our population has been ageing quite rapidly, and therefore we have a higher cancer incidence. The good news is that because of better treatments and better awareness, we don't have really such a rising rate of cancer mortalities. In other words, our survival is increasing. So there are many people in the community who need support.
What is the single most important step to improving your health?
The big one for Ulster Cancer Foundation for 40 years has been we need to cut the levels of smoking in our population. And we try to get the risk through by giving the example of 1,000 young people. If you can imagine 1,000 young people in one of our high schools, and let's imagine that all of them started smoking today and that none of them ever stopped. Well, in their lifetime, their risk of being shot or murdered would be 1 in 1,000. 6 out of that 1,000 would die in road accidents, but 500 of them would die because they smoked. So if you're a smoker and you keep on smoking, there's a 50% chance it'll kill you. So people know that smoking isn't good for them, but they don't know just how bad it is for them. There is just such an enormous risk. So that's the big message we're trying to get through.
How important is it for everyone to look after their well-being?
The research on all of this is saying that people can make big changes to their lifestyle, and that those changes will be much more important to their well-being than, say, changes in the environment or just bad luck. People have control of their health and they need to take control of it. And that's why we're supporting the Northern Bank's well-being campaign, because we believe that employees and employers can work together. They can bring the messages home to their family. We hope that the message will get through that we can change our diet, we can take a bit more physical activity, we need to wear sunscreens if we're going to be out in the sun, we need to avoid using sunbeds, we need to stop smoking. And all of that can be done if people work together and if organisations like ourselves support what's happening in occupational health in the workplace and other settings.